Part 8, Thoughts and Behaviors. The brain is a storyteller. It seeks out information from our surroundings that fit that story. These stories may sound like I'm broken or I'm full of arthritis. There's many different versions of these. What these stories do, though, is they cloud our view and distract us from what's important to us. Try this experiment out. Take your hand and gently place it in front of your eyes. How much of the world can you see right now? Now, take your hand and move it just a little bit further away from your eyes. How much of the world can you see now? Now consider your thoughts like your hand. If your thoughts are front and center, right in front of you on your mind, they distract you from what's really important to you. But if we gain a little separation from those thoughts, suddenly things become a little bit more clear. I have had many patients that have felt destined for something like a knee replacement because they thought, well, it must be coming one way or another, or because they've had a parent who's had one and they thought they were destined for one as well. Of course, being human means we're wired for negativity, but that doesn't mean that we can't change that story. So what's your story? Take a look at these two columns, left and right. Which group of phrases sounds more like the thoughts you've been having? Do you think you could find a way to shift your thinking and the word choice that you use from the column on the left to the column on the right? So let's move on to moving towards change. So what's important to you? What are your values? Is it family, friends, work, community? There are many great options. If you're not sure, just imagine it's your 90th birthday party and a friend is going to speak about you in your life. What would they say? This might help you identify your values. Now, consider how closely you're currently living compared to your values. Then, what are your barriers to living according to those values? Have you identified something in your body as a barrier? Your knees, your hips, or something else? Now, what are you willing to make room for to live according to those values? Perhaps you'd be willing to experience mild soreness in pursuit of being more active to achieve a value that's important to you. Now, what is the first step you're committing to live according to those values? It might be helpful to rewatch this and take a screenshot of the slide in order to fill this out completely. Let's try another experiment. This is called the pink elephant experiment. What I want you to do is not think about pink elephants for 30 seconds. How did you do? Did you think about pink elephants at all? What this experiment teaches us about pain is that trying to avoid pain is likely going to bring it up even more. Another approach might be to see if you can find a way to move forward despite the pain being present. This does take a lot of work. Another practice you could try is called noticing and naming thoughts. When one of those unhelpful thoughts that you've identified comes up, try this. Say, I'm thinking about, and then insert your unhelpful thought. Or say, I notice I'm thinking about, and insert your unhelpful thought. This will help you get some distance from those thoughts so that that thought does not consume you. And one other strategy you can try is to focus on what's going well with your treatment plan. Maybe make a daily list of 1, 2, or 3 things that have gone really well that day.